This is a story of how I healed my hand from feeling numb after a medical procedure didn't go as planned. When I had this a medical procedure is for those of you who do not know, I have SMA type 2, which is a progressive disability that slowly takes away your ability to walk, eat, and breathe over time. Because I have because I have this disability, I take treatments that is not a cure, but it is a form of treatment to help stabilize my progression of my disability from worsening as fast, from atrophying so fast. And this medical treatment is called Spinraza. And when I take these Spinraza injections, they are medication that is administered in your spinal cord through a lumbar puncture. So for me, having SMA on top of having severe sclerosis, the area that they have to do the injection site isn't any ordinary area for an ordinary person who doesn't have severe sclerosis such as mine. They would just do a spinal injection at the lower part of their back doing a lumbar puncture. For me, because I have severe sclerosis, they have to go at an area of my, I don't want to be too detailed, but they have to go from my buttocks and angling upwards into that spinal cord area, reaching to the lower part of my back to administer the medication. While I have these injections, I do get put under anesthetic. So I do get put under anesthesia. I am asleep during the procedure. The procedure is roughly around 30 minutes to an hour, depending on how the day is kind of going with them trying to find the spot so they can administer the medication. Again, especially in my case, because of my severe sclerosis, it's a little bit more complex. While I had this medical procedure is again how I get put under anesthetic, excuse me, how I get put under anesthetic is I do again be put to sleep. So while I am asleep, I have to turn to my right side. And when I am laying on my right side, what happened here is I ended up laying on my arm wrong. And I say it is my fault for the mere fact is while they turned me and positioned me, the medical team is I always have a great team of people, and the medical team is always reassuring me and asking me, "Hey, are you okay? Are you comfortable before we put you to sleep? Before we move forward, like, are you comfortable? Before again we put you to sleep, before we sedate you." And me being me, while I was comfortable, but I felt while I was laying on my right side, I felt like I was laying on my arm wrong. And me being me, I was just telling myself everything's going to be okay. You're overthinking this situation, like you're okay. And the reason why I had this talk with myself is because usually, not all the time, it's getting a little bit easier now, but a lot of the times when I have these injections, I do become, I don't want to use the word paranoid, but I am somewhat paranoid a little bit. Like I'm always asking questions. Hey, am I going to be put to sleep? Hey, I always try to reassure that I am going to be put to sleep during these procedures. And the reason being is because a quick backstory is when I was at the age of 11 years old in 2010, I had a back surgery that didn't go too well. And because of this back surgery, it caused me to have dozens, and I mean dozens, of back surgeries because I had caught a very bad severe infection, which then caused me to not only have this infection, but to be in and out of the OR just within my back alone. So, just with my back alone, I have had dozens, and I mean dozens of surgeries, not trying to be dramatic, but really the last number I can remember is like around 38 by me going in and out of the OR. At that time, I was in the hospital for 2.5 months. So, as you can imagine, just within that life experience, especially at being such a young age, you're being such a young age and going through such experience is not the easiest, and it's not definitely the easiest to endure through and the easiest to kind of overcome, especially when it comes to things happening again when it comes to your back, such as my injections. When I get my injections, it's in my back area, so I always try to say, hey, am I going to be put to sleep? Just because of that experience alone, as you can imagine, it left quite the mark, right? And I want to highlight too, it's nothing on the medical professional's fault. It's no doctor's, nurse, any medical team's professionals' fault with what happened with my back surgeries or with what goes on with my Spinraza injections. And the reason why I say that is simply because, again, my case is not the easiest. It's quite complex, especially when it comes to my SMA. I mean, with my severe scoliosis. Excuse me. The reason why I had mentioned this is because every time I go into an injection, I'm always asking again my anesthesiologist more so, am I going to be put to sleep? Am I going to be sedated? And I always ask questions. Like, I ask him several times. So the reason when I was laying on my side and I was comfortable, but I wasn't as comfortable, I just told myself, Vic, you're being paranoid. You're overthinking the situation. You're okay. So while I was laying on my side, I did feel myself laying on my arm wrong, but I didn't quite think to the extent my arm is going to go to sleep, and when I wake up, it's going to have a negative effect. I didn't think that. So again, I lay onto the bed. They transfer me from the gurney to the table that they are going to do the injection on, and they roll me over. They turn me, position me, get everything prepped so they can move on with the procedure. And as right before they sedate me, they ask me if I'm comfortable. Am I doing okay? How do I feel? And I reassure them I'm okay. Like I'm fine. I'm great. All right. I'm comfortable. They ended up sedating me. When I woke up, my right hand was completely numb. So when I say I had no feeling whatsoever, I literally had no feeling. This right here, I could not feel whatsoever. I couldn't feel this. I couldn't feel the pinch. I couldn't feel anything. Me being my optimistic self, I woke up and I didn't think too much of it. I just remember I couldn't feel this, and me thinking to myself, you laid on your arm wrong. It's temporary. Give it a few seconds. Give it a few minutes. A few minutes ended up going by, so I had no feeling. Minutes turned into hours. Hours. I remember after the procedure, again, me being optimistic, I'm like, your arm is just really asleep. Just give it some time. It's going to be okay. After the procedure, me and my mom at the time, it was just us two. We ended up going out to have a dinner. And while we went out to dinner, I didn't know that when you do not have feeling in your hand, you also lose your grip. You lose your strength. And as we went to dinner and I went to pick up my utensil, pick up my fork, it completely just slipped out of my hand. And as you can imagine, that was quite the experience within itself, where being able to do something one day and then the next, like literally the next second or even the next day, not being able to do so can really affect one personally. Once I dropped my fork, it was a huge negative experience, and then that's when I began to question, is this it? Like is this permanent? Once I woke up from the procedure, minutes turned into hours, hours turned into days, days turned into weeks. So as throughout that time frame, there's a lot more to this story, but for the context of this video, we were just talking about my hand here. So during that time frame, what did I begin doing? So for the first few days, I was in a world of despair. I had no hope. I had no feeling. Me trying to brush my teeth, pick up my phone, operate my computer, trying to feed myself became a very, very big challenge. Me trying to figure out how can I adapt to picking up my utensils just so I can feed myself. How can I utilize the TV remote? Because when you do not have feeling, you lose your sense of grip. And let alone, because I have SMA, I am not the strongest person physically, A lot of stuff was my world. I was falling into this world called despair because I was able to do one thing yesterday, having to wake up and not being able to do it the next. Again, can affect you mentally quite significantly. What I began doing, the first 2 days was very difficult, challenging, and I tried my absolute best to stay optimistic, and I tried my absolute best to try to adapt to this new lifestyle that I was living. What I ended up doing is what I always have done. Anything that I don't know and I am interested in, I do research. I do my diligence. I began going on Google and I began going on YouTube, more so YouTube, looking up ways on how I remember it was along the lines of how to heal, how to make your hand go unnumb, or how to heal your hand from being numb. It was along those lines. And to start typing in word for word, and as you start to do research, then you start to pick up new ideas, new ways on how you can further your research. And I ended up coming across this one video. I cannot remember exactly what it was called. I can't even find it now, even if I tried. But I came across this video where it was like talking about healing your hand is you cannot feel it, but just do this. And your mind knows that it's there. It's just like your connection is lost. So I somehow was able to get through to myself. I was able to interpret the understanding of the video, and I was able to get my own interpretation. Like your connection is there. Like your mind is able to say your hand is here. You're able to move it, right? But the outlet was there, but the connection wasn't. That's what I mean to say here. So the outlet was there, meaning I was able to do this. My mind was able to register there was something there. But the connection to feel this was missing. And I somehow convinced myself that if your mind can connect to that outlet, connect back to that source that can make your mind register, hey, this is here. Hey, this is what it feels like. Hey, this is how to move. This is what you can do. Then I knew I would be okay. Through many, many hours, through many, many days, literally from the moment I woke up to the moment I went back to bed, I was doing this all day. If I was on my chair, I would be on my lap and I would just be moving my fingers around. Every finger, every part of my hand that felt numb, I would move it. And I would just move it. And sure enough, after several weeks, I was able to regain my feeling. And what I hope you can gain from this video, if you were trying to heal your hand, I'm no medical professional, I'm no expert or advisor to give you medical advice. Quick disclaimer, I'm no medical professional. Anything that you are going through, please seek help from a medical professional if you have any professional questions that needs to be answered and maybe even addressed. I just wanted to mention that really quickly. But for me, the value I hope you can gain from this is if your hand is numb, maybe it works on other parts of your body as well, such as your feet, for example. I don't know. But for me, the value I hope you can take away from this is sometimes in life when you are going through a transition, a new change, something in your world just happens to drastically change the course of your direction. Don't lose faith. Because I had that little ounce of faith that everything will be okay. While I was in the middle of doing this, it was very, very hard to trust, yet let alone believe that everything would be okay. Because having the knowledge and the life experience of being able to do something one day to the next not being able to do so can really affect you mentally. And seeing the progression of your disability, more so especially your disability, and you're seeing things slowly being taken away from you, and that one thing that you utilize most feels like it is slipping away from you, don't lose faith. Don't give up. Because I can assure you that if you can do your 100% best and you put in your 100% effort and you find ways to adapt to your situation, you find ways to improve your situation, even if you have the opportunity to fix your situation, I can assure you that if you endure through that process and you keep the faith that everything will be okay, there are better days that lie ahead. But the only way for you to reassure that tomorrow will be better is you must put in the effort, taking the necessary steps, moving you forward today. I love you. I appreciate you. And remember, grow through what you go through. Much love.